I'm Maya Hayakawa. Money Daily starts right now. Traditional or alternative medicine is big, huge business. In the year 2000, there were just 8 countries in Africa that had policies covering traditional medicine. But today, we have 40 countries that have legislation. Ghana, Mali, and South Africa have established partial health insurance coverage for traditional medicine products and services. Many people across the continent have relied on this medicine as the main source of their healthcare needs. Now, in South Africa, an estimated 72% of the black population uses traditional medicine because it's affordable and accessible, according to researchers. But today, there are more than 34 research institutes dedicated to African traditional medicines globally. Some hurdles they face include accessing funding required to make significant strides in formalization. This, though, may change soon, as there are currently 15 countries which now allocate public funding to traditional medicine research, according to the World Health Organization. Now, the organization also says that there are now over 40 herbal medicines included in the National Essential Medicines list. So, how can traditional medicine be made mainstream? That's what we asked our Biz 100 experts from across the continent. Listen to this.
Yes, I think we should mainstream African traditional medications. This is because most of these medications have proven to be effective, they are easily accessible, and they are acceptable by these communities. We can do this by taking up these medications for clinical trials to ensure that they are given in their right doses and also documented for reference. Again, I think we should create a body that merges African traditional medicine and non-traditional medicine.
We inherited a certain notion from the colonial era that deemed African traditional medication as unscientific simply because it fails to meet certain Western standards. We know that this is untrue, but to give people confidence to use our traditional medication, we need to create regulatory authorities, systems, mechanisms, bodies, committees, what have you, so that they guide practitioners in this space.
Widespread education via digital and other media will also go a long way to destigmatizing the sector, increasing accessibility to healthcare for marginalized groups, and promoting the use of traditional, indigenous African plant medicine both on the continent and in the diaspora.
Earlier on, I spoke to Father Dr. Anselm Adodo, Director of Pax Herbal Clinic and Research Laboratories, and I started by asking him, how can we integrate traditional medicine into the conventional health system?
Yeah, what we can do is first for the government to create a very good platform for discussion, for communication, proper communication, where we have the different stakeholders coming together to talk, to share ideas together. And from there, they'll be able to understand what are the challenges from both sides. And they will be able to find a middle way.
Are there economic benefits for countries that invest in alternative medicine?
Drug preparation, the pharmaceutical companies will tell you how expensive it is to have medications. So it is a huge area of benefits, for investment in traditional medicine in Africa. Apart from the ecosystem, the cultivation of plants, medicinal plants, trees, which can grow quite easily in Africa.
How can we have indigenous African medical knowledge be formalized and utilized well?
I think the challenge at the moment is that the African governments, they are a bit too Western oriented. They tend to think that it is only the Western method of treatment, medicine, that is valid and worth investing in. So the first thing is to see that this is an area that is very relevant culturally, scientifically, and otherwise to the local people.
Are you seeing a shift in perspective?
Yes. For example, in Nigeria, there is now a new bill which have actually officially recognized traditional medicine as part of the healthcare system. So it has been passed already. Now we are now trying to see whether we can establish an institute, a federal government institute of traditional medicine knowledge, where people can now study, learn traditional African medicine in Nigeria. This is very important because it will open the door for more research into traditional medicine. So I'm positive that a lot is happening. We're trying to make this explicit as much as possible, because sometimes the traditional medical knowledge may give the impression of being too implicit, which means it's only located in the individual healers. But now we need to recognize that it's an open knowledge.